You have spent anywhere between 10 and 30 years building expertise in your specialty, whether that is pharmacology, radiology, surgery, or running a hospital. And now, someone like me walks into your office and says, Doctor, you need to learn product management with generative and artificial intelligence. Your reaction is completely fair. Why? I'm a clinician. I treat patients. I run departments. I built this institution. What does product management with generative and artificial intelligence have to do with any of that? In the next 30 minutes, I am going to show you exactly what it has to do with your career, your department, your hospital, and why the doctors and the hospital leaders who layer this skill over their existing specialty will be the ones who shape the next decade of Indian healthcare. And the ones who do not will spend that decade implementing someone else's decisions. Stay with me. The common thread, the problem every doctor shares. The AI avalanche has already arrived. Here is what is happening right now across Indian hospitals in tier 1, tier 2, or tier 3 cities. Artificial intelligence tools are being purchased. Software companies are pitching administrators. Vendors are promising everything from automated diagnostics to billing reconciliation to real-time patient monitoring. And hospitals, your hospitals, are buying. A large number of those implementations are underperforming. Some are outright failing. Not because the technology is wrong, but because nobody in the hospital, not the doctor, not the administrator, not the department head, had a structured way to evaluate what they were buying, define what they needed, or manage the rollout once the vendor left the building. That structured way of thinking has a name. It is called product management with generative and artificial intelligence. I want to be very clear about what I mean, because product management with generative and artificial intelligence is not a technology course. It is not a software development course, and it is not for engineers. Product management with Gen and Agentic AI is the discipline of taking a real problem, a clinical problem, an operational problem, a patient safety problem, and designing a solution that actually works in the real world for the people who have to use it inside the real constraints of your institution. It is the discipline of asking, what is the problem we are actually solving? Who experiences this problem and how severely? What does a good solution look like and what does a bad one look like? How do we measure whether it worked? Every single one of you, regardless of your specialty, is already doing a version of this. You just do not have the vocabulary for it. And without vocabulary, you cannot sit at the table where these decisions are being made. Now, layer in artificial intelligence, and the stakes go up dramatically. Generative artificial intelligence gives you an intelligent assistant that can draft, summarize, explain, and synthesize. You have probably already used something like this. Agentic artificial intelligence goes further. An agentic system does not just respond to your questions, it takes actions. It makes decisions inside a workflow. It books, it flags, it routes, it escalates on its own within the rules you set for it. Think about what that means in a hospital. An agentic system can watch a patient's vitals, decide that trend is deteriorating, escalate to on-call team, update the EHR, and notify the next of kin without a human touching a button. That is extraordinary power. And extraordinary power without structured oversight is extraordinary risk. Who defines the rules? Who decides when the system should escalate and when it should not? Who owns it when it goes wrong? That person needs to be you, the clinician, the administrator, the department head, not the vendor, not the software engineer. That is why this matters, This is the common thread. Now let me speak to each of you directly. If you are a preclinical faculty member, pharmacology, pathology, physiology, biochemistry, anatomy, let me describe your professional reality as I understand it. You are among the most analytically rigorous people in any medical institution. You understand mechanisms, you understand data, you understand the difference between an association and causation. You have been trained to think in systems. And yet, in the hierarchy of hospital or medical college, the clinical and administrative decisions frequently happen without you. Even when those decisions involve the very biological and pharmacological systems you know better than anyone else in the building. You are consulted occasionally. You are rarely in the room when decisions are made. Product management with generative and agentic artificial intelligence changes that. Let me give you a real world illustration. A mid-sized private hospital in a tier 2 city decided to implement an artificial intelligence powered drug interaction systems alert. The vendor promised a 40% reduction in adverse drug events. The system was implemented. Within 3 months, physicians were ignoring 80% of the alerts because the alert threshold was set so low that it fired for interactions that were clinically irrelevant. The signal to noise ratio was so poor that doctors simply stopped trusting it. The chief of pharmacology in that institution had flagged this risk before going live. She understood exactly why the threshold was wrong. But because she did not have the language of product management with generative and agentic AI, she could not articulate her concern as a product requirement. She could not frame it as a metric. She could not get it into the vendor's contract. Her clinical knowledge was correct. Her ability to translate it into a product decision was missing. That translation ability is what we build. In pathology and laboratory medicine, artificial intelligence is moving faster than almost any other specialty. Computational pathology platforms, tools that analyze whole slides images using deep learning, are being adopted in cancer centers, research hospitals, and reference labs across India. Products like SIG-Tuple are already operating in this space. Now imagine you are a pathologist. A vendor walks in with a slide analysis tool. They show you sensitivity and specificity numbers. They show you a paper from a journal. With product management and Gen AI and Agentic AI intelligence training, you know what questions to ask. What was the training data set? And how is it representative of the Indian patient population? How does the model perform on rare variants, not just common presentations? What is the regulatory status of the Central Drug Standard Control Organization software as a medical device framework? What is the escalation pathway when the model is uncertain? Without that training, you evaluate the tool on vendors' terms. With it, you evaluate it on patients' terms. Here is what your professional journey looks like when you layer product management with Gen Agentic AI onto your preclinical expertise. In the near term, you become the person your institution trusts to evaluate any agentic tool that touches your domain. That is a recognized advisory role and everyone is paying for it. In the medium term, you can move into clinical informatics, into artificial intelligence governance committees, into regulatory consulting for your medical technology companies who needs clinicians who understand both biology and product system. In the longer term, you are positioned to design the next generation of diagnostic and pharmacological AI products for Indian healthcare. There is no one better qualified, but only if you have the product vocabulary. Your science is your asset. Product management with Gen and Agentic AI is the commercial and the operational language that unlocks it. Now, a word about paraclinical doctors, radiology, laboratory medicine, anesthesia. Paraclinical is where AI disruption is most visible and most immediate. You are at the epicenter. If you are in radiology, laboratory medicine, or anesthesia, you are not on the periphery of agentic AI conversation in healthcare. You are at the center of it. Artificial intelligence in medical imaging is arguably the most mature and commercially advanced segment in the healthcare technology globally. Products like AI Doc, Cure.ai, and Niramai are already operating in Indian hospitals. AI Doc, AI operating system, AI OS, is being deployed in radiology departments to triage critical findings, flag bleeds, flag pulmonary embolism, and prioritize work list. In laboratory medicine, automated cell counters with built-in machine learning, digital pathology platforms, and real-time quality control systems powered by artificial intelligence are live. In anesthesia, decision support tools for drug dosing, artificial intelligence assisted monitoring of depth of anesthesia, and predictive models for post-operative complications are entering into the market. So, here is the critical questions for each one of you. Are you the person who defines how these tools are used in your department? Or are you the person who uses them the way someone else defined? Let me be direct about something that makes radiologists uncomfortable. There is a narrative in the technology industry, and unfortunately in some academia, that says artificial intelligence will replace radiologists. I want to tell you clearly that narrative is wrong, but not for the reasons you might think. Artificial intelligence will not replace radiologists. It will replace radiologists who cannot work with artificial intelligence system, who cannot define their requirements, who cannot audit their outputs, who cannot govern their deployment. The radiologist who survives and thrives is the one who can say to their hospital management, I can tell you exactly where this artificial intelligence tool adds value and where it does not. What is the error modes and how we should structure the human AI workflow to protect our patients. This is a product management with Gen and Agentic AI intelligence skill. Specifically, it is the skill of defining human AI interaction design, which is the core module in the workshop we run. Of all the specialties in a hospital, anesthesiologists already think like most product managers. You just don't realize it. Every time you design an anesthesia plan, you are defining requirements, what the patient needs, what the surgeon needs, what the safety margins are. You are doing a risk assessment, you are choosing between alternative approaches, and you are monitoring outcomes in real time against a predefined target. This is exactly the mental model of a product manager running a clinical workflow. Now apply that mental model to artificial intelligence systems being introduced into your operation theater. Closed loop drug delivery systems, AI assisted ventilator management, predictive models for hemodynamic instability. You are the most qualified person in that room to say whether those systems are safe, effective, and correctly calibrated. But only if you have the language to make that evaluation systematic and communicable to your hospital leadership. Here is your career trajectory when you add product management with Gen and Agentic AI. For radiologist, you move from reporting function to a strategic function. You become the chief clinical product lead for imaging technology in your institution. Or you consult for medical technology companies who needs a clinical voice in their product development cycle. Cure.ai, Neramai, Siemens Healthcare India, these organizations pay for exactly this kind of expertise. For laboratory medicine specialist, you become the person who defines the digital transformation roadmap for your laboratory. That is a recognized leadership role in hospital administration, and it is a bridge into the health technology companies building the next generation of diagnostic products. For anesthesiologists, patient safety officer roles, clinical governance leadership roles, and medical device consulting are all natural extensions. The interaction of drug systems, device systems, and AI monitoring is one of the most complex and therefore the most valuable domains in healthcare technology. Your clinical expertise is the credibility. Product management with Gen and Agentic AI is the leverage. Clinical doctors, surgery, medicine, pediatrics, obstetrics, gynecology. Most senior audience segment. If you are a surgeon, a physician, a pediatrician, or an obstetrician, you are making life affecting decisions under uncertainty every single day. You synthesize incomplete information. You weigh competing tasks. You weigh competing risk. You make a call and you own the outcome. This is not a skill alone. That is a decision making discipline that most product managers spend years trying to develop. So when I say you need product management with Gen and Agentic AI training, I'm not saying you lack decision making ability. I'm saying that context in which your decisions now happen and will increasingly happen include software systems, AI recommendations, digital workflows that were designed by people who have never stood in your ward, in your theater, and in your consultation. And if you do not learn to engage with those systems on your own terms, someone else will make those designs decision for you. The surgeon and the algorithm. Here is a real scenario. A large multi-specialty hospital in India implemented an AI-powered surgical scheduling system. The algorithm optimized for theater utilization, maximizing the number of cases per operation theater per day. Within 6 months, the system was generating schedules that were technically optimal by its own metrics, but clinically problematic. It was scheduling complex cases without adequate buffer for complications. It was not accounting for the cognitive fatigue of the surgical teams. It was optimizing for throughput, not for outcomes. The surgeons knew this, but they had no mechanism to formally define what the system's objectives should have been in the first place. No product requirement that said patient safety and team capacity are constraints, not variables. With product management, with Gen and Agentic AI training, that conversation happens before the system is deployed, not 6 months after it has caused harm. In obstetrics, the application of agentic artificial intelligence is particularly significant and particularly sensitive. Continuous fetal monitoring, risk stratification for preeclampsia, automated escalation for obstetric emergencies. These are active areas of AI development globally. And Indian maternal health outcomes are a clear case for thoughtful technology intervention. But here is the governance question that your hospital administrator may not think to ask. When an agentic AI system decides that a fetal heart rate pattern is non-reassuring and escalates to the on-call team, who designed that decision threshold? What was the clinical evidence base? Has it been validated on Indian obstetric population? What happens when it fires at 3 a.m. and the on-call resident is managing 3 simultaneous emergencies? These are product management with Gen and Agentic AI questions. They are also patient safety questions. They are the same questions. In pediatrics, the stakes of poorly designed health technology are among the highest because dosing errors, diagnostic misclassifications, and monitoring failures in children have consequences that are not recoverable. AI models trained primarily on adult population are being deployed in pediatric settings without adequate validation. A pediatrician with product management with Gen and Agentic AI training knows to ask, what was the age distribution of the training data? Has this model been tested on neonates, on premature infants? This is not a technology question. That is a clinical governance question framed in product language. And it is a question that can only come from you, not from the information technology department, and certainly not from the vendor. For senior clinicians, the career upside of product management is not about becoming a product manager. It is about expanding your sphere of influence. As a surgeon who understands product systems, you become a clinical advisor to the health technology companies. a medical director in digital health ventures, a key opinion leader in AI governance conversation at national level. As a physician or a pediatrician, you are positioned for roles in clinical informatic leadership, in National Health Authority working groups, in academic health system innovation centers. As an obstetrician, maternal health technology is one of the highest priority investment areas in Indian digital health. Your clinical credibility combined with product literacy makes you extraordinarily valuable to the program designers, to government health agencies, and to private sector innovators. You do not have to leave medicine. You expand what medicine means and what it pays. If you are a hospital chief executive officer, chief operating officer, chief medical officer, or founder, you are already making product decisions. Every vendor you sign a contract with has a product. Every system you implement in your hospital is a product. Every digital health partnership you enter is a product relationship. The question is not whether you are a product decision maker. You already are. The question is whether you are making those decisions with a structured framework or on a basis of vendor presentations, peer recommendations, and hope. Because hope is not a product strategy. Here is a number that should concern every hospital leader in India. Industry estimates suggest that between 40 and 70% of healthcare IT implementation fail to deliver their stated return on investment within the first 3 years. Some studies put the failure rate of hospital AI implementations specifically even higher. These failures are rarely technology failures. The vendor technology usually works. The failure are implementation failures, misaligned requirements, inadequate change management, no defined success metrics, no governance model for when the systems makes a decision that clinician disagrees with. Every single one of those failure modes is a product management with Gen and Agentic AI failure. Every single one is preventable. Now let me describe the specific governance gap that Agentic AI creates and why it is a board level risk, not just an IT risk. And Agentic AI systems in your hospital can take autonomous actions, discharge recommendations, prescription alerts, bed allocation, billing pre-authorizations. Each one of those actions has a legal and a regulatory dimension under Indian law. The Digital Personal Data Protection Act of 2023 governs how patient data is processed. The Central Drug Standard Control Organization Software as a Medical Device Framework governs how clinical decision support software is classified and regulated. The National Accreditation Board for Hospitals framework touches quality management systems that increasingly include digital components. When an agentic AI system makes a decision that leads to an adverse outcome, and this will happen because no system is perfect, who is liable? The vendor, the hospital, the clinician who accepted the recommendation? That question does not have a clear legal answer in India yet. But hospital that has documented governance framework, a clear record of how the system was evaluated, what its approved use cases are, what the human oversight protocol is, that hospital is incomparably stronger position than the one who just plugged in the vendor's system and hoped for the best. Product management with Gen and Agentic AI at executive level, governance and risk management. This is your language. Let me end this segment with a positive case, not just the risk case. The hospitals that will define Indian healthcare in the next decade are the ones that can consistently take a clinical problem, design a product solution around it, implement it with discipline, measure its impact, and iterate. That is a capability. Capabilities compound. Narayana Health did not become what it is by accident. Apollo did not scale across 50 cities by installing whatever vendors recommended. These institutions built systematic capabilities for evaluating, implementing, and improving operational systems. Product management with Gen and Agentic AI is the formal name for that capability. The workshop we run is designed to give your team, your department heads, your administrators, your clinical leads a structured, practical version of that capability in 2 to 3 days. This is not theory. Every session ends with a deliverable that your participants take back to their institution. A product requirement document, an AI readiness assessment, a governance framework sketch, real work done in the room. For the chief executive officers and founders in the audience, the personal upside of this knowledge is board credibility. The ability to have an informed conversation with your digital health vendors, your technology investors, and your regulatory interlocutors without depending entirely on intermediaries to translate for you. For chief medical officers, you become the bridge between clinical reality and technology strategy. That role is increasingly recognized as a distinct from both clinical and administrative function, and it commands corresponding influence and compassion. For chief operating officers, operational AI, supply chain, bed management, billing, workflows optimization is your domain. Product management gives you the framework to be the buyer of operational AI on your own terms, not the vendors. The C-suite that understands product is the C-suite that does not get sold to. It is the C-suite that negotiates. Let me bring this together. Whether you are a pharmacologist who knows more about drug systems than artificial intelligence model that is being trained to predict adverse reactions, or a radiologist whose pattern recognition is being compared to an algorithm, or a surgeon whose theater schedule is being optimized by a system that has never seen a patient bleed, or a chief executive officer who is signing a software contract with crores of rupees. The common thread is this: AI systems are going to make decisions that affect your patients, your department, your institution. The question is whether you will be the person who defines how those decisions are made, or the person who lives with the consequence of decisions made by someone else. Product management with Gen and Agentic AI is not a technology skill. It is a power skill. It is a skill of being in the room where the decisions are made and having the vocabulary to shape them. If today's episode gave you even one thing to think about, I would ask you to do two things. First, share this episode with one colleague who needs to hear it. One person in your department, your institution, your network who is sitting in the same uncertainty about AI and not sure where to start. Second, reach out. There is a link in the description. Come for a conversation about what is happening in your institution, what you are trying to solve, and whether this workshop is the right fit. Thank you for your 45 minutes of your time. That, from a doctor, is not a small thing, and I do not take things lightly. See you in the next episode.